Hey guys, Dr. Baker here. One of the really interesting things to me as someone whose background is in orthopedic surgery is the number of people that go on low carb ketogenics or are often carnivore diets and note significant reduction in various musculoskeletal issues, whether it's arthritis, tendonitis, even things like peripheral compression neuropathies like carpal tunnel syndrome. And I see that over and over again, not to the point of many, many thousands of people reporting that they've seen dramatic improvements. Now, it doesn't happen for everybody. Let's be clear about that. But for many, many people, it does. What percentage is still unknown? That would be nice. It would be nice to be able to do some sort of interventional trial to get better data on that. But we know that it's happening. And the question is, why might it be happening? Well, traditionally, a lot of people will lose weight. And we as an orthopedic surgeon, I was taught that, the body weight, mechanical loading forces across any particular joint is some multiple of the body weight, 3 times, 6 times, depending on what joint you're talking about. And certainly there's obviously some validity to that, but I don't think that's the major issue, because we often see people whose joint pain goes in remission absent weight loss or with minimal weight loss. And so there is an inflammatory component. The other thing most people, I didn't know this as an orthopedic surgeon, but I've subsequently come to find this out, that body fat, adipose tissue itself, does often elicit inflammatory cytokines. So you have these inflammatory chemicals, mediators, and chemicals floating around your body affecting the joints from the excess body fat. So certainly losing weight will have at least a couple benefits there. The other thing we often see is that the gut seems to have an impact on particularly inflammatory arthropathies. These things would be things like rheumatoid arthritis or psoriatic arthritis and spondylitis. And we see a lot of people resolve those too. And it might have to do with the relationship between, gut dysfunction and autoimmune disease, which is pretty well described in the literature. There's another component that I think is important, is the concept of glycation. We know that a lot of older joints exhibit an increased amount of what we call advanced glycation end products, which is again associated with glucose, fructose, lipid peroxidation things, and those things are all impacted by our diets. And so when those things are improved, when your diet's quality is clearly improved by removing the sugary, starchy, high glycemic foods out, when we're removing some of perhaps the oxidized oils, those will have an impact as well. And then there's another interesting thing back about glycation. One of the most potent anti-glycating agents known is something called carnosine. Now, some of you may have heard of carnosine, but if you haven't, carnosine is a nutrient that is found pretty much exclusively in animal products of various concentration. I think, I may be wrong on this, but I think actually, weirdly enough, I think octopus might have a really high level of carnosine in it. So maybe we could do a study on people eating a lot of octopus and joint pain. That'd be an interesting thing to see. Anyway, every time I ask this question, I get a lot of people saying, yes, my joint pain has been helped, or a few people saying, no, it hasn't. I'd like you to, if you don't mind, share your experience here. And hopefully, like I said, if I were to go back in time and knew all this stuff as a young practicing orthopedic surgeon back in the day, I might have been more inclined to, and again, this goes to you primary care physicians, because one of the most common things primary care physicians see are musculoskeletal pains, because it's such a common occurrence. And instead of sending them to the orthopedic surgeon for referral, I want you to ask them about their diet. Let's clean up your diet a little bit, see what happens there. I think if we would take that approach, we would probably prevent a lot of people, developing, arthritis over the years, or at least limit it or push it back to a much later age, as we are seeing younger and younger people developing arthritis, which again probably has a significant, percentage of its origin comes from their diet and lifestyle. So there you go, guys. There's studies out there that would indicate that low carb is superior to low fat for arthritis, which is kind of interesting as well. All right, let me know what you guys think. We'll talk to you soon. Bye-bye.